Okay, I'm gonna get you to sit up for just a second.
Okay.
I'll change out my cassette. I'm gonna go straight into the lateral elbow. That's the other thing. If it's all on the same side, save your laterals to the end. Even if you only do, say you have this 3 views of the wrist and you have a forearm, you know you have to do laterals. So when you go to a lateral wrist, go ahead and do your lateral forearm. And then the last one will be your AP. So this way you're not having your patient do this. And because if they're in a lot of pain, the more you rotate them and twist them, you got to think about that process. Again, usually you can save all the laterals, especially if you end up having elbow, forearm, and wrist, save all the laterals for last. Okay? Because they're only in that position once. And that may be the only time you can get them in that position. So, all right, ma'am. I'm going to center my elbow here. Your elbow. All right. Get her nice and centered. All right, I need you flush back down for me. Okay. Now, if I need to, see how far away she is? I can actually come in closer. Come closer, come closer, come closer. Allow her some support. This makes it a little bit easier for her. Okay. All right. Don't do this. Don't do this. Do not manhandle your patient. Do not, that's what not to do. So I'm matching her. Okay, I have my 90 degrees. Okay. Elbow into center. I know your elbow felt amazing getting that tattoo.
Oh, it was great. I didn't want to murder him at all. I still have about 1 or 2 more sessions on.
That's how I felt with my knee socks. So this one here. So this one you can put here. I allow here or here. Okay. So there. Come a little. Make sure. I usually yes, this is soft tissue, but I still want soft tissue. So I usually, the bulkier part, that's where I stop with my collimation. So I make sure I have enough. Okay? So the other thing too, when you're setting up for lateral elbow, they do not need to be like this unless you're doing the coil method. Coil method for the elbow is a trauma view. Okay, I've actually included some of those projections in your additional review. Okay? All right, so her thumb still needs to be up. Okay? Remember, wrist, lateral forearm, lateral elbow has to be up. Okay? If they are down like this, it's not a true lateral. You will get dinged for positioning. Okay? So the other thing too is how my crosshair comes across here. Hits right here. You find your happy medium. Okay? This is not always going to separate this perfectly out. Okay? Usually literally follow this up. Hits right here. Do not do this to your patients, what I'm doing right now. Because if they have an elbow injury, this is going to hurt. Do not do that. Lightly, you can be like, okay, I'm just making sure, support it, that's fine. But again, you want to make sure it comes straight across. Okay? Again, center of the elbow. Okay? That will be for your lateral elbow. Comments, questions, concerns? Okay. It's pretty straightforward with these, specifically when we get into these. All right. Wait till we get to feet. If you have an aversion to feet, you go ahead and get over that. All right, so I'm gonna go ahead and have her straighten back out for me. Okay. All right, so I have her centered, have my elbow. Her elbow is actually centered. I can see where my condyles are. She is my favorite. I'm glad you went with him versus the traditional.
Mm-hmm.
I like the traditional Alice, but the...
You know I like my creepy stuff.
All right, so got this here. I'm gonna go side to side. Okay, so she's AP. Pop my marker here to the lateral aspect. Okay. All right, so again, we're hitting If you are unsure, because again, she does have tattoos, if you're unsure, you can have her bend, and when she flats back out, I know it's where my finger's still at the crease of her elbow, okay? So you want to be right in there. Actually,
I need to adjust you some.
okay. There we go. Okay. So, and the other thing too, if you want to, you can straighten this up just a little. And I'm gonna change the trajectory of my cassette to match everything. Okay? That way your crosshair also matches the long axis of your cassette. She's nice and straight, even though this kind of deviates this way. I can't control that. Everybody's arm does this. But as long as the bulk of it is going down this part here and you are centered, you are fine. But watch your patients, because they like to do this. Move out of the way. They're like, oh God, this is uncomfortable. They'll do this on you. So you need to come back and check. All right, that's your AP. Since she's already here, palm is up. All right, so what I'm gonna get you to do now is how you have your hand. I need you to just kind of lean back a little bit, and you're gonna turn your thumb down a little bit. There you go. That's what I'm looking for there. They're already palm up, so it makes sense just to go ahead and go straight into your external, okay? Because again, if they have a lot of pain and discomfort, you're minimizing that, okay? So I'm gonna match this up a little bit more. She's nice and flat. Change trajectories. There we go. That's what I'm looking for. When it's centered on your elbow. This is your external oblique. Opening, giving that joint space opening between your radius and your ulna. The radial tuberosity is no longer superimposed in this projection. Okay? Because we're opening in the door. Okay? All right.
Please don't leave your patient in that position for forever, because a lot of people find it uncomfortable.
Yes. So be quick.
Yeah.
So. All right. So from here. So you doing okay, ma'am?
Nope.
You say no.
Yep.
Okay. Well, suck it up. All right. So what I'm gonna get you now is put your hand flat down. Sweet. That's it. Now, if she wants to sit up a little straighter, she can. That actually helps to get where she is. So I'm just gonna realign everything. Be careful that they don't go too far over, because they're perpendicular at this point. I don't need her like this. I just need a nice little, and if I want, I can actually do it better from this side, but you can come in from the side. See how my fingers angle? Coming down like I'm going down a slide. That lets me know I got a good 45 degrees. Okay. All right. I'm gonna center her back up. And that's the one nice thing. A lot of the times it's very minimal things that you have to do. Okay. Lost. Still, nobody's telling me to check my SID. Not paying attention. Always check your SID, because again, when you go in vertical, accidentally hit vertical, and you hit long, it's gonna change it. So don't be afraid right before you walk away. Check one last time. All right. And hey, she still has her lead apron on. I haven't had to move that. First thing that goes on her. Perfect. So, nice and centered. Might collimate a little more side to side. I have a little more room here. Be careful on this one. This one here is easy because you get so close and you're not thinking about it. You push it in and it ends up in the shadow. Okay? Gotta be mindful of that. So I'll back it up really close. I am gonna collimate a little more side to side. And there you go. That would be for your internal oblique. This is literally taking your radius, bringing it over top, taking my medial, yes, and kind of rotating it into profile. This one, your lateral condyles, if it helps, they almost always look rounded on your images. And you almost always have like a little bubble that you'll see for your medial epicondyles on your images to kind of help you find little bony landmarks. okay? But again, all we're doing is taking the radius, bringing it over, they're crossing over, but this is allowing me to bring my olecranon into view, and I'm actually getting to see the posterior aspect of the distal humerus, okay? Hence, the olecranon going into the olecranon fossa, okay? Next to your cornoid process, this is that little, the Pokemon bite. Pokemon. Pac-Man. My daughter's into Pokemon, sorry. So, that's what we want for that one, okay? So we've done lateral, we've done AP, and we've done both obliques. So you end up ending with your internal. Because you've gone from AP, external, because she's already there, then just have her bring her hand down. Most patients prefer this anyway because it just makes it a little bit more comfortable for them anyway. So like, oh, this is easy. And you center them up, line everything up, double check the SID one last time. That would be your 4 projections for your elbow.